So the last slides, I kind of want to put it out there. What are the questions that you should ask your doctor wherever you are in the nation? Is that the first question is that ask your doctor what exact subtype of T-cell lymphoma do you have, right? T-cell lymphoma itself, it's not an adequate diagnosis. You have to know what exact subtype, right? If they tell you peripheral T-cell lymphoma, ask exact subtype. What exact subtype of peripheral T-cell lymphoma do I have? The second is that, what is the goal of treatment? Are we trying to treat for cure, or are we trying to treat to stop the disease from progressing further? But I have to be on the therapy for a long time. I cannot be cured, because that really determines how much side effect, right? Or like this risk benefit. If you have a therapy that keep the disease under control, but you live miserably, then it might not be a good therapy for you. And there's a lot of therapy we can try in T-cell lymphoma. So always important to understand what's the end goal of the treatment. And for our female patients, women patients, I always, ask about if you're planning to have a baby. There's ways that they can preserve eggs. There's ways that to protect your ovary during the treatment, but that has to be done earlier and pretty well thought of before the treatment. And then always ask about the side effect, and also ask them about, stem cell transplant, or if you can be considered for a clinical trial. And here are some information and resources for T-cell lymphoma. So the NCCN patient guideline, where I steal a lot of photos from, is very helpful. You're already here, so the Grace community have a lot of good resources. Lymphoma Research Foundation and Leukemia and Lymphoma Society has very nice videos about T-cell lymphoma as well. And then there is a T-cell Leukemia Lymphoma Foundation. And for patients with cutaneous T-cell lymphoma, I will highly recommend to be connected with Cutaneous Lymphoma Foundation. They have this weekly webinar between patients, and they have someone to navigate about the symptoms, treatments, trials, and everything. And then, of course, in your specific cancer center, they might have patient and family services. So I list one of the example for Moffitt. So I like to close it with a quote I saw at our Moffitt Cancer Center, and that's why I said our patient really teach us a lot, not just about science, but also about life, right? So information give you power, connection give you strength, and together they give you hope. So I hope you enjoy this talk, and then we can talk more in the upcoming sessions. Yeah.